Hey everyone, Elizabeth Scala here, and I'd like to talk to you about an interesting topic related to your elbow scar, so the incision site, and a word that is tricky, desensitization. All right, I'll have it in the notes in this video, desensitization. So you get out of elbow surgery in a cast, the cast is removed, you start going to therapy to get the arm moving, and you have your incision scar, and you have sutures or staples or just those sutures was what I had. Stitches, that's the word I was looking for, holding the scar together. They'll either dissolve, they'll take them out, they'll cut them, they'll go away. And then you have your scar, and then you have your elbow that's healing. And you may or may not notice in many, if not most, unless I'm specifically thinking otherwise, of my videos, I am wearing a tank top, right? And at occupational therapy, I went to occupational therapy in the months of September, October, November, and December, and January. A lot of January, most of January. But I was wearing tank tops, and I became known as the tank top girl because it was easier. So my occupational therapist had to massage my arm, had to move my arm, put gel on my arm, put electrodes on my arm. So it was just easier all the time for me to wear a tank top. So I became known as the tank top girl. That being said, your arm is likely going to be sensitive to touch, especially the scar. And I don't know about you, but I'm grossed out by scars. I'm pretty disgusted by blood or guts. And so for me, it was really hard to touch, look at, and feel my scar. Like my occupational therapist wanted me to massage it every single day. And I tried, and I did some, and I did. But I don't think it's daily. I'll have another video about massaging your scar. Anyway, so here we are at my closet because I want to talk to you about desensitization and how you can desensitize your arm from feeling super sensitive. So your scar is super sensitive, your arm is super sensitive to touch, and you're kind of, oh, don't touch my arm. So let's get a peek into my closet. What my occupational therapist had me do to desensitize my arm was literally to take my elbow and my scar, let's see what we got here. I'm gonna grab corduroy. So corduroy is a feeling that's pretty hard, right? Not hard, it is soft, but you've got the ridges in the corduroy. So you take your elbow, sorry about that, hold on one second. You take your elbow and literally, oh boy, rub it on a fabric. So I did to corduroy, I did to sweater, a very like thick and textured sweater. You know, you're rubbing your elbow on that sweater, the scar on that sweater. Mind you, you want this stuff to be clean. You're not rubbing your scar in dirt. But literally, I would just take my arm, and she wanted me to just run across all the textures and feelings in your closet, Elizabeth. Just go to your closet and rub your arm everywhere. So I did actually start doing that. And initially it was very difficult. And initially I did it for like a couple of seconds, and I'd be like, I did it. And I would be done for the day. And as you can see now, I mean, I can literally touch any kind of fabric to my arm. But so that's how you would desensitize your arm, your scar, your incision site, and get it used to feeling textures, and get it used to feeling clothing, and get it used to feeling touch. So as I said, I'll have another video about incision site scars and massaging your arm, but try it. If you are finding difficulty, if anything rubs up against your arm and you're like, oh, you're really sensitive to it, try just going into your closet, going into your dresser drawers, and literally rubbing your arm, your incision site, your scar along all of the various textures. So hopefully that's helpful to help you desensitize your elbow. We'll see you next time.